A lot of people these days are having a lot of issues with sleep. Insomnia, not getting to sleep, or waking up in the middle of the night and not being able to get back to sleep. One of the most major reasons I've seen for this is your cortisol. Cortisol is a hormone from our adrenals, and the normal pattern of cortisol is it's highest in the morning and lowest at night. I do a lot of adrenal testing with people so I can find out these levels. If your cortisol is high at night, it's going to keep you awake, it's going to keep your brain going. You're not going to be able to shut down and go to sleep. There's lots of wonderful supplements that can help lower cortisol at night. And there's also ones that can raise cortisol in the morning if you're having issues with energy. The other big thing that can help with sleep is keeping your blood sugar stable. When people go to bed, sometimes they haven't eaten for several hours, which is very common. And in the middle of the night, like at 2 or 3, they'll wake up. They won't feel hungry necessarily, but they'll wake up, they'll be wide awake, they won't be able to get back to sleep. And like I mentioned a minute ago, that could be from high cortisol. But one of the reasons cortisol goes up at night is it's trying to feed your blood sugar. If your blood sugar or glucose drops around 2 or 3 in the morning, cortisol will go up to compensate because part of cortisol will break down into glucose. If that happens, then it's very hard for you to get back to sleep. A lot of people will tell me, well, I'm not hungry in the middle of the night. And I'm like, well, that's because your glucose levels have gone up because of cortisol. So it's important to get your adrenals checked. It's important to take some supplements at night that can help lower your cortisol and maybe bring it up in the morning if you're tired. Adrenal support is very important. It will help your insomnia, it will help your energy, and in general, it's really good for your immune system.